Doctors of Reddit, what is your most oh my god what is that moment while treating a patient? Not me but a friend. He was delivering a baby of a frequent drug user, and after the baby was delivered all that was left was a lovely afterbirth. Now, these are not pleasant things in the first place, but with the constant infections and wounds this woman had, she had somehow managed to develop a cyst or something pus-filled on the wall of the womb, which had ruptured during childbirth. What came out of that woman he said was the most vile thing a woman could birth, a mixture of afterbirth, rotten flesh and uterus lining and a decent amount of creamy pus, yellow, brown and red, MMHMM. The baby was fine though, quite healthy too. Remembering how nasty regular afterbirth is, I really feel bad for your friend. That's so disgusting. I'm not a doctor, but a couple of years ago I was talking to my dentist. She was complimenting me on my sparkly white teeth and healthy gums. I mentioned something along the lines of I could never be a dentist. I couldn't deal with those who have bad breath or rotting teeth. Then I made the mistake of asking what the worst case was for her. She told me about a time that a woman came in with pretty much all of her teeth completely rotten and an abscess on the back of her mouth. The dentist apparently started working on the back of the mouth and popped the thing. She described the smell as that of a dead animal. Apparently the smell was so bad that it permeated the thin mouth cover and the abscess had popped with such force that some of the pus landed on her shirt. I think of that story every time someone tells me I should do interpreting at hospitals. And I'm going to brush my teeth now. This is a nod to my grandfather, who was a doctor, way back when. He was called out to a coal mine where a miner had been crushed by a coal cart. Apparently there wasn't much left of the poor guy, but as my grandfather was first on the scene as such, he noticed that the cart safety lever wasn't on. This is important, because if the deceased miner was found to have been operating the cart without the lever, the company wasn't obligated to pay his widow a penny. Needless to say, he flicked the lever into position, and made a tragedy easier to bear on the remaining family. A friend who is a family doctor was treating a preteen girl who was complaining about a pain in the back of her neck. He did a preliminary examination and found a lump, and thought that it was likely her cyst that had become infected, and the parents agreed that he should remove it. That's when he noticed it move. Turns out it was a large botfly larva that the girl had picked up while vacationing with the family in South America. It was the size of a nickel. My dad is a nurse. I have asked him this question before, and most of stories are about people who come in with deodorant cans up their butts and try to claim that they were climbing in a windows and fell on the can or something. But there is one story which he has told me which really stands out. When my dad was in his mid-20s, he worked in the emergency department of a hospital. One day this morbidly obese lady comes in complaining of abdominal pain. They start to look her over. Everything was going fine until they decided to look in the folds of her gigantic stomach. When they smelled this horrible smell, they found a decomposed chicken wing covered in maggots which had started eating at part of her skin. Yum. She was saving it for later and forgot about it. Mom's an RN. One night, dude walks into the holding a bag under his crotch. Dude got drunk with a bunch of his friends. The DD drove a pickup, and this dude and his buddies sat in the flatbed, speeding down the parkway. The dude, in his infinite wisdom, decided to stand up. DD hit a bump. The dude went flying and found out why they call it a split. One night, dude walks into the holding a bag under his crotch. His scrotum and taint had split, and his testicles and his lower GI tract had spilled out. He was carrying them in the bag. Dude was rushed to surgery. Full reproductive capability restored. I have seen a lot of things, but the one thing that really sticks out is something I saw as a medical student. I was on a general medicine rotation and was seeing an elderly lady for urinary problems. Specifically, she was having trouble holding her urine. She mentioned in passing that she had something coming out of her vagina, like a mass, but she couldn't see what it was. My resident and I decided that we ought to take a look. Upon examining her pelvic region, we were unable to use a speculum to visualize the interior of her vagina because there was a firm mass protruding from her vaginal introitus. The mass was her bladder. It had prolapsed. There was a patient who came in, well-known history of diabetes. When I saw him, the worst of it was already over, but he still had legs like sausages and the smell in the room was like a garbage dump. There were these strange bands around his ankles that were indented to over a centimeter deep. Apparently he had developed an ulcer on his foot, so instead of cleaning it and bandaging it, he decided to just put a sock over it. Eventually the ulcer developed into gangrene and the pus began to soak through the sock. The smell became overwhelming even for him, so he decided to seek medical attention as a responsible adult would do. Just kidding. He put a plastic bag over it. Eventually the pus seeped around the edges of the bag and started leaking again, giving rise again to the horrific smell. So now things were getting out of control, so now he decided to get it properly looked at. Got you again. He put another plastic bag over it. This process repeated about 9-10 times. In the air they had been peeling off this giant mass of plastic and dead tissue glued together with pus and held on with elastic bands around the ankles. That's what the indents were. It was like his foot turned into a giant pus onion, with each layer smelling worse than the previous one. 2 or 3 nurses apparently threw up and they had to rotate people in to do the next layer. He wasn't even in much pain because he had long-standing neuropathy in his feet, which was why he was able to ignore the problem for so long. And that's why you always leave a note. This will probably get buried, but my father-in-law was a doctor for 20 years. Twice he's been really surprised. We'll call him Dr. J. This first time was a patient that came holding his stomach, with the front of his jacket bloody. He looked very out of it and it was obvious he was under the influence of some drug. Dr. J asked him what the problem was and the guy calmly said, "My stomach hurts." "Well, let's have a look." Smack. As he pulls the guy's coat away, his intestines spill onto the floor. Turns out him and a friend were doing some drugs. One of them pulled out a loaded shotgun and accidentally shot the other guy in the stomach. He explained it very matter of fact. "Oh man, I need to go to the hospital." The story was years later. Dr. J had a male patient come in complaining of abdominal pain. He decides after an examination that they need to do a scope. So there he is, minding his own business, navigating through this guy's bowels with a camera, when suddenly a light facing the opposite way blinds the camera. It turns out the guy was giving himself the old in and out with a flashlight and lost track of it. I have no idea why it was on. Dr. J had told the man he had to consult with another physician, then left the room and collapsed from laughing so hard. He said it was like watching a cartoon where somebody runs down a tunnel and meets a train head on, except the tunnel wasn't butt and the train was a flashlight. I can imagine the flurry of activity that follows someone dropping their intestines on the floor of a hospital. That split second of comprehension, right before yelling for 24 things stat, is the ultimate calm before the storm. Worst in last 24 hours, patient after colon surgery returned to with a wound infection. I took out a few staples to drain the fluid. Instead, about 100 milliliters of feces bursts out all over the bed, patient gown, etc. Patient has a fistula to the bowel. Worst ever. Went to see a patient with an ingrown toenail. It was just hanging on by a thread, so I froze the toe and pulled the nail off. There were maggots living under the nail, like a lot of them. You get used to this stuff. The fistula was surprising, but I'm beyond being grossed out by it. However, the maggots really caught me off guard. IQ doctor in a major trauma center here, with years of her experience. Let's see. Group of intoxicated teens driving around town. One passenger in the back opens the window and projects his upper body out of the car while other people hold his belt. Stoned drunk driver sees this and decides to scare his friend by passing close to a street sign. Moments later, people kick in the door, screaming. I jump there. They grab my coat and drag me to the car, where a body without head and most of the arms rests hanging out the window. Freaked out dude tries to give me the head while screaming do something. Drunk girl riding a motorcycle forgets the helmet in the bar and decides to turn the wrong way in a one-way street. Hits car, flies head first into a street pole. Massive brain injury, making cerebral tissue swell, which would be the cause of a rather early death. But she was saved by neurosurgery and a basal skull fracture, making her brain insinuate out to the nose and helping relieve pressure inside the skull. Huge amounts of brain tissue came out her nose for days, and the nurses did a great job in wiping it constantly so the family never had to see it. She survived with major sequelae. Dude riding his motorcycle hits another motorcycle, almost loses his leg. discharged from the ICU very well, with a shaft inside his femur to help it heal. Goes berserk the day after and discharges himself from the hospital. A week later he was readmitted, the leg swollen red and copious amounts of green pus oozing from the surgical incision. Lost the leg. Survived. Strange dude gets his bowel sac pierced multiple times, at home, by himself. Bowel sac got infected. His nuts were floating in pus. The infection had spread to the abdomen and fascia on admittance, causing necrotizing fasciitis. Awful smell. Lots of surgical removal of infected tissue, including testes, penis, rectum, bladder, all in vain. A good friend of mine is a nurse, and by nature has the best stories. She was working the med-surg floor in the hospital and had a female patient who was so morbidly obese that she needed a service animal to help her. No, not a dog, as most people would think, but a monkey. This lady had a goddamn service monkey. It would get her glasses for her, grab the remote for the TV, all kinds of things. Odd, but not really a WTF moment, until she walked into the room to take the woman's vitals and finds her breastfeeding the monkey. That was, yep. Not me, but a friend who is a doctor told me this story of when he just graduated with his medical degree from Johns Hopkins. A very large woman was being prepped for a gastric bypass surgery. When cleaning her, the nurse found a hard, crusty object in the patient's belly button. What was it? A calcified cockroach. Yep. The woman had no idea it was there either. Not a doctor, but when I was a paramedic student we used to do rotations in the ED. A guy was brought in from what I assume must have been a horrendous nursing home. He looked fine at first, but once they took his pants off the issue became apparent. His testicles were about the size of a football, and necrotic. It's called Fernier gangrene. He must have had it for quite some time as well, judging by the size, color and smell. He had a stroke in the past and was now much less alert than his normal. It looked painful, but the worst part was the smell. It smelled like rotten crab meat. One of the residents that came in to evaluate him looked as if he was going to vomit and left the room within 20 seconds. I felt terrible for the guy. He had no clue what was going on, and he clearly must have become used to the smell. When I went home that night, my roommates and friends decided to make appetizers. One of them brought mini crab cakes. The smell gave me an image of that guy's testicles immediately. It was the cruelest irony I could think of. My father was a plastic surgeon in the emergency room of a major southern city, so he has stories plenty. So here is one of the worst. A family of 4 was driving on an urban highway that passes right by the hospital. The parents were in the front seats and their 2 young children, boy and girl, 3-5 years old, were in the back seat, apparently unrestrained by child seats or seat belts. Coming from the opposite direction was a speeding and swerving woman driver in the throes of a psychotic episode. As the 2 cars approached from opposite directions, she swerved into the median and hit a barrier which launched her into the air, upside down. Her car landed on the roof of the family's car, bending the roof of the rear portion of the passenger compartment downward and backward in such a way that left the mother and father unscathed but neatly sheared off the top portions of both children's heads at the brow. The accident happened right in front of the hospital, so in a horrified delusional panic, the parents carried their 2 children into the emergency room, with inside of the craniums exposed and devoid of their contents. Obviously nothing could be done. That is so goddamn horrific, but at least his was quick for the kids. I'm not a doctor, surprise, but this happened to me when I was in 4th grade. I noticed a small lump in the middle of my tongue and thought, oh, I must have burned it, whatever. The next morning, however, it had grown by a lot. It was freaky looking, so I told my mom. She flipped out and took me to the doctor right away. Near tears along with my mother in the ear. She was not good at hiding emotion, and her fright was really scary. We waited for hours as she bothered the attending nurse to no end. Finally, they called my name and brought me to a room. It started as a normal visit until the doctor said, I've never seen anything like that. Cue mom's crying and my heart pounding. This was a freaking doctor. Growing up in a medical community, my 10-year-old brain was conditioned to think that doctors knew everything. So they brought in another doctor, and another. Then they put me on a dentist style chair with huge, bright lights shining on me. Before long, there were 5 doctors and the chief of staff staring at my tongue. My mom was sitting silent in the corner, absolutely horrified. With a huge group of doctors surrounding me, I did feel a little more comforted, but was still very scared. So what did this brain trust of brilliant medical minds come up with? A biopsy? A CAT scan? Number. We're going to try poking it. Even at 10, I was thinking, can I get a second opinion? I could not, however, talk because they were literally holding my tongue. They sprayed me with a local anesthetic that tasted like mustard and the chief surgeon washed up, put on goggles and a mask. He slowly moved the shining metal prod into my mouth. I could feel the pressure on my tongue. He pulled back, looked at me and asked me possibly the grandest non sequitur I've heard in my entire life. When was the last time you had popcorn? I was completely caught off guard. A couple days ago I remembered clearly because I was trying to eat it quietly as we watched the X-Files Sewer Monster episode, original airing. You jelly. So the doctor sets on my chest bib thing a perfect half of a kernel husk. It had, apparently, suctioned itself to my tongue. And because tongue tissue is so quick to generate, it was essentially absorbed by my body. Lots of doctors laughing. My mom crying for joy now, and I was totally stunned. I even wound up in a big medical journal because of it. So I went to finish out the rest of the day at school and did an impromptu show and tell, which mortified most of my classmates. Then I got nauseous from the anesthetic and puked up my Cheerios in the nurse's office where my best friend was also lying down. Unrelated. All in all, it was a memorable day for me and likely the doctors. TLDR. I was inspired to start a band called Dr. Popcorn Suction Fiasco. I was a junior asked to see a man with a tracheostomy. The nurse had sent him in because it was bleeding. The senior asked me to head in to get a swab. When I pulled the apparatus away from his neck, maggots rained down across his chest and neck. Wife is a trauma surgeon. She's sleeping now, but I get about an hour every night where she unloads the horrible crap she sees. One that sticks out is the girl and her boyfriend on the motorcycle. They were taking a sort of underground turn from one highway to the next and he was going way too fast. He started to get close to the wall, so the girlfriend on the back decides, best idea, go ahead and put your foot up on the wall of the tunnel. Foot catches the wall. She flies off. Leg breaks at the femur and the broken bottom half of her leg drives straight into her gooch. She gets a middle-aged mail in for stomach pains. Says he was at a party, got drunk, woke up at another party and hasn't been able to juice in a few days. Tox screen comes back positive for amphetamines. C and weed, so a good night out. CT scan comes back with one. Full-size Glade air freshener can totally up this guy's butt. Bottom first. It is so far up that the colon has collapsed around it at the anus and created a vacuum behind it. They try a number of ways to get it out with no luck. Finally, she gives him a paralytic because his beehole keeps fighting back, and my wife is now double-fisted up this guy's butt. There is a picture of her holding the can somewhere out there. This is the second aerosol can she has removed from the butt of someone in town. First one was a full-size spray paint can. The man bought the can at Lowe's, placed it in the bag and inserted it with the handles of the bag hanging out his butt, thinking he could just use the plastic bag handles to pull it out. He broke the handles trying to pull it out. The bag still had the receipt in it. Lots of dog attack stories. Recent one is 8-year-old boy attacked by 3 PBs with more than 100 puncture wounds. 7 PB attacks this week, only 1 provoked. In accordance with the Reddit circle jerk party around here, they are not the most aggressive dog. They are, however, the dog most likely to cause injury or death during an attack by a wide margin. I'd have to get her on here to really do this justice, but with her schedule, not likely. This was back in med school when I was following an anesthetist to clerk this 60-70-year-old gent with penile cancer who had come in for a pinectomy. Simply put, to have his entire penis chopped off. We go into this room with the patient and his son, in his 30s, to see if the guy was fit for his op. He was decently kempt but smelled like he hadn't showered in a year. As we started taking his history, he shoved his right hand into his pants and started moving it vigorously, moaning as he went at it. Just so you know, the anesthetist and I are female, and his son was clearly having the most embarrassing day of his life. A very painful 10 minutes went by. Our clerking interjected with moments of "oh." A few hours later in theater, after sedation, we removed his gown, and voila, a 15 by 15 centimeters black necrostong with ulceration and oozing pus stares us in the face. And the smell, I couldn't eat lunch after. At that point in time, I was glad I was still a student because I just said I had a tutorial to go to and fled the heck out of there. TLDR. Patient masturbated his rotting dong in front of me. That's ridiculously gross, but, and I'm sorry to say this, if I knew you were about to chop off my penis, I wouldn't mind one last hurrah to say goodbye. Not a doctor, but I work in the air. Had a female patient come in with abdominal pain. Begin examination. Noticed the worst rotten smell imaginable coming from her vagina. Upon pelvic exam with doctor, we pulled out a dead, rotten fetus that she miscarried weeks prior to coming in. One of the few times that I remember actually gagging. Will never forget the look and smell of that poor thing. I remember my dad, who is an obstetrician and gynecologist, was visited by some police officers while at medical school. They handed him a bucket of organs and proceeded to ask, "Can you identify whether these intestines are human or animal?" He also had another case back when he was doing house calls, where he was locked inside the house by a wanted criminal with a knife, who had disguised his identity. My dad climbed out the window, called the cops, and ran for his life. He emerged unscathed. Hahaha, I can imagine an OB-GYN student looking quite puzzled at that bucket of organs. Physician here. Hospital doctor for those wondering the difference. I fear this has turned into a gross out battle rather than a diagnostic quandary, but here goes. My most I have no idea what I'm looking at moment was the first patient I saw with McCune-Albright syndrome. I may have spelled that incorrectly. It's an extremely rare de novo mutation that affects endocrine organs, hormone secreting organs. So you get overgrowth of many of these organs and overproduction of hormones. They tend to be acromegalic. Think Jaws from James Bond. But they also get large facial deformities from bone overgrowth depending on severity. It's a horrible condition to suffer from, but thankfully rare, and one for the gross out battle. As a resident in ED, I saw a youngish alcoholic female who the nurse was having a hard time passing a urinary catheter. I went to put it in, spread her legs, and a ball of maggots poured squirming out of her vagina. Poor self-cares and lower leg venous insufficiency from child C cirrhosis causing skin breakdown equals maggots. As I stood there bent over in a state of shock, she let out a large fart which sprayed the maggots in a plume of death into my face. At that point I just walked out to wash my soul, reconsider my career and have a coffee. You can't make this crap up. Shudder. A famous Australian, he is in the entertainment industry, who was a trainee doctor, tells a great story of a guy who came into the ER with something up his rectum. They took x-rays and had to take it out. Turns out the patient had a hammer up his rectum. A doctor asked if he could keep it to put in his museum of things taken out of people's asses. The patient said no, the doctor could not keep it. The patient's reason, it was part of a set. Not a doctor but a nurse. Was working in emergency for first 5 years of my career. Old guy about 80 presents. Foreign body in his butt. Turns out to be a war vet. And had a live shell about the size of a slim coke up his ass, probably about 9 inches long. He was very stoic. However, we had to call Australia's version of the bomb squad to assist in the removal. Exciting days. Poor lonely old guy. TLDR. Geezer, so artillery much insertion. As a medical student in a urology office, we had a young healthy male come in with problems urinating. He said he had hesitancy and a decreased stream. Pretty odd for a young male. So the doctor went through all the standard questions and it was a benign physical exam. Did a prostate exam and nothing was out of the ordinary there either, so after a couple visits a cystoscopy was done. A little black tube with a camera on the end is shoved up your pee hole to look at your bladder. Well, this guy had strictures all over the place. Extremely odd. So more questions like, have you ever had a catheter? Nonchalantly, oh yeah, hundreds of times. For what? Well, when my partner and I host parties I take a catheter and drain my bladder. We both thought that was strange and thought maybe he doesn't want to miss any of the party by having to pee. We were clueless. So then he states, and then I fill my bladder up with red or white wine. Okay, it doesn't work like that. Butt chugging sure, but not the bladder. So here comes the kicker. This guy would go around and pee in people's mouths to give them a drink of wine. It was a big gay orgy, come to find out. I just recently caught up with an old friend who is now an OR nurse, and she told me this gem. She was preparing a morbidly obese woman for surgery, scrubbing her down and cleaning the areas up underneath fat rolls that haven't seen the light of day in God knows how many years. When she picked up one particularly hefty roll around the side of this lady, near the lower back, she stopped suddenly. Is that a bone? She mustered her courage and continued to investigate. A moment later she uncovered the skeleton of a small kitten. The bones were fused with the still rotting flesh of the sad little creature. Holding back tears and vomit, she walked around to face the large woman. "Mom, I don't want to alarm you, but I've just found the remains of a small cat in one of your fat rolls." Lady's response, seemingly unfazed, "Oh, I've been looking for him. Apparently people this huge develop rather thick calluses in their fat rolls from all the friction. This cat could have been clawing for life in there and she might not have felt a thing. Poor little guy died trying to claw his way out of heck. The cat and the fat." This is a little different, but I worked as a tech in a mental hospital. One of my jobs was to go through and catalog a patient's belongings when they're admitted. One day a woman came in for her 3rd or 4th stay. She's pretty disheveled, as per usual, and smells pretty rough, which means going through her bag will be no fun. I pull a pair of gloves on and get started. Opening the bag releases the most awful smell, like something had died in the bag. So, with my gloves on, and considering a second pair too, I dig in. I find normal stuff. Dirty shirt that has holes in it, used tampons, coins and cash that are sticky, bits of fur. Wait, I think, bits of fur? That's strange. And here at the bottom of the bag is more. I lift up some dirty pants and there it is. A dead cat, slightly rotting. Something had died in this bag. After she was kicked out of the last place she had lived, she stuffed the cat in the bag to keep it warm and safe, and apparently forgot it. While my wife was in medical school, she helped treat a patient who was having difficulty urinating. She and the doc asked all the preliminary questions, but they still weren't sure what the problem might be. So the doc orders an X-ray. She notices a tangle of dark lines in the patient's bladder. The doctor then went in to show the patient the results as she was thoroughly stumped. After the patient sees the X-ray, he freely offers up that he likes to take baby snakes and let them slither up his urethra where they ultimately die in his bladder. His reason for doing this? Well, he said it gave him a funny feeling. That's a trip to the psych ward right there. I am not a doctor but a nurse going on 18 years. Yes, I have seen some amazing things in my career. People talk about finding maggots in wounds. Well, we actually use them in our hospital to clean up wounds. Ordered from a lab in Cali, they are raised in a sterile environment and packed into a sterile specimen cup and shipped overnight. Normal application is 500-1000 maggots per wound. They are placed into the wound and secured with a mesh DRSG and left in the wound normally 2-4 days, then washed out and disposed of. They only eat dead flesh, usually air and felt, and do a tremendous job so that the PT can avoid surgery. I once had to put $20,000 on a young lady who came in with necrotizing fasciitis of her leg. It started as a cat scratch on her knee. PT ignored it over several days while it was eating her tissues. She came in unresponsive in the home and septic after keeping it from her family. When she arrived, the only thing holding her leg on was the muscle bone and dead tissue. The Points family wished to save the leg and avoid amputation. Surgeon said to do maggots. 5 hours later they were applied. She eventually lost the leg and underwent amputation. Early on in my career, we took a call for an unconscious unresponsive female. We get on scene and fire is already there. They are in full bunker gear with SCBAs. We could smell it from outside. This lady had a colostomy and developed C. diff. She rolled out of bed and the bag tore out. She laid in an ever-growing puddle of her own crap for 2 days before someone found her. The sores she had were so infected. The smell was awful. We had to drag her outside and spray her off with a water hose before transport. That ambulance was out of service for a week being deckened. Was working in a free clinic, and the residents of a halfway house came as a group to get checked out. I picked up a file found my patient, and we went back to our little curtained off area. He seemed a little off, but so did many of our patients. High rates of drug abuse, mental illness, etc. Can't do that, so that didn't really throw me. I asked him what we could do for him today and he said, I want you to look at my head. I ask him what is wrong with his head, and he just says that it hurts and I need to look at it. I ask him to take his hat off. He says, I think you should have gloves first. That should have been my first warning. I assure him it will be fine, and he slowly takes off his hat. Underneath is a durag, so I still can't see anything, but that's when the smell started. It's a smell you can't really describe unless you've smelled it, but many of the other healthcare people here will know. It was foul, putrefying, like flesh was rotting. I can't even find the words. I ask him to take off the durag, and so he starts to peel it off. As I get hit full force with a wall of the worst smell I've ever experienced, I see his head is entirely covered with abscesses. Big ones, inches in diameter, all coalescing together to completely cover his scalp. Many were bursting open, with pus oozing out. His head was a minefield of pus. I decide that now might be a good time to grab some gloves. It turns out he also had similar abscesses in his armpits, which I looked at and confirmed, and in his groin, which I did not. Everything was oozing pus and smelling so incredibly bad. By this point the smell was permeating throughout the rest of clinic, and as close as I was to the source I don't know how I didn't throw up. Although he was in pain, he didn't seem to understand how serious it was. That level of infection anywhere is bad, but in the head has the risk of finding its way into the skull and therefore the brain. And it took a lot of persuading to convince him he needed to go to the ED for higher level treatment than we could do. This was near the beginning of my training, and I've seen a lot more gross things since then, but that's the moment that I always remember. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.